Hello, everyone. I'm Dr. Gabi, and this is InnerVet, where we talk everything about pets. So, today we're going to discuss a very important subject, which is how to know if it's the right time to take your pet to the veterinarian. This is a very tricky subject to owners because most of the time it's very difficult for them to know if they need to go to the ER right away or if they can wait 24 hours or 72 hours to go. So, today we're going to discuss all of that and what you need to ask yourself before you go to the vet. But before we even get started, I wanted to remind you to subscribe to my channel so you don't miss any of my videos about pet health, or you can send this video to someone or just like it. So, yeah, let's get into it. Today, we're going to discuss triage. This fancy word, we usually use it in veterinary medicine or in the health industry because it helps us assess if the patient needs immediate medical attention or if they can wait maybe like 5 minutes, 10 minutes, depending if we have another patient that's more critical than that one. But in this case, in this video, we're going to discuss how to take this triage technique to your house so you, as a pet owner, can have confidence enough to say, okay, my pet needs to go to the ER right away because this is a life or death situation, or maybe we can wait until the appointment tomorrow, or maybe the appointment in 2 days. So, all of this is basically using your head when your heart is just freaking out and not thinking correctly. Because I get it, I'm a veterinarian myself and I work as a vet tech here in the US. But when something happens to my pets, I freak out completely, and the veterinarian in me just leave the building. So that's exactly what this video is for. So you can keep calm and assess the situation and do the best for your pet. Okay, we're gonna start with the real emergency situations where you wanna go to the vet right away, you don't wanna wait. Or you might want to check with your local vet or give them a call so they can triage your pet and see what's going on. The first one is seizures. And in here, you want to make sure to have a record of the situation and to explain to the veterinarian exactly what happened. Maybe your dog was sleeping and he randomly started shaking, foaming from the mouth, and maybe he urinated himself or he had a bowel movement that it was more like involuntary. So you want to record all of these details in situations that happen so your veterinarian can discard anything else that might be going on. In second place, we have hit by a car accident or a high-rise fall. And even if you don't see any like evident trauma or evident wounds in your pet, you have to take him to the vet because there's some injuries that happen inside the body that we can't see from the outside, and if we don't take care of them on time, it might be a life or death situation. Then we have cat open mouth breathing, and this is super important because cats don't breathe through the mouth. They're not like dogs that they release the heat by panting. When the cat is breathing with an open mouth, it's very, very concerning, and you have to take them to the ER right away because your cat might pass away if we don't take care of what's wrong right now. And another critical situation with cats is urination issues in male cats. Female cats can also have urination issues, but in males, it's a little bit more concerning because it's very common when they have obstructions or urination issues by just getting stressed, and they can certainly pass away from these situations. So you want to take care of the issue on time so your cat doesn't have any worsening of the symptoms, which could lead to a very long hospitalization. Unfortunately, another very, very common situation is a toxin or poison ingestion. And we all know that dogs love to eat things that they're not supposed to eat, and cats love to hunt or play with things that they're not supposed to. So it's very important that as soon as you suspect that something like this maybe happened, you go to the vet right away because the sooner you treat the condition, the best results you're gonna have. Another emergency would be severe limping or lameness. And by severe, I mean when they're not able to put any weight on that paw or leg. And usually they decide not to walk anymore or spending the whole day laying down because it's too painful to use the paw or the leg. So, if that's the case, you want to take them to the vet. The next three are very similar, and it's when we have dog fights and that creates a wound. So, it might be a laceration wound, you might have an uncontrollable bleeding, or you might have a puncture wound, which, in my opinion, are the most tricky wounds to assess because what happens during a dog fight is that the dog grabs the skin of the other dog and they shake it with their teeth. So they're creating a lot of air underneath the skin. And even though us as owners, we see just a dot, if you check closer, you might be able to see that the wound is not just that, and it's a very broad space that we need to control. And attention, dog owners of cardiac patients, because this next symptom is very important for you, and it's going to be abdominal bloating. If you notice that your dog or cat's abdomen is bloated or more like swollen or hard than usual, this is a reason to go to the vet right away, because even though it can mean several things, some of those things are life-threatening. So you want to make sure that it's not free fluid in the abdomen, it's not a heart failure. So I would recommend to go to the ER right away. And the next one is the most typical symptom or situation that you might have with your pets, which is vomiting and diarrhea. But what's the difference? You have to go to the vet if it's an uncontrollable vomiting or diarrhea situation. Because if they vomit more than 4 or 5 times a day, especially if it's a cat, they're gonna get dehydrated very quickly, and a severe dehydration in your pet might be life-threatening as well. And this last situation is going to be for our diabetic patients. So you're gonna go to the ER right away if you start seeing diabetes complications in your pet. Okay, but there are some situations where you as an owner might say, oh, but how do I know my dog is having uncontrollable vomiting or diarrhea? Like, how do I know if I need to go right away, wait 24 hours, or wait 48 hours even? And that's exactly what these questions are for. These are going to help you know exactly if your dog is having a severe condition that needs medical attention right away, or if it's something mild that can actually wait 24 hours, 48 hours until your local vet has an available appointment. So these are the questions that you want to ask yourself. Did they eat anything abnormal lately? Maybe something from the trash, something from the yard. Maybe I didn't even notice that they ate something. Maybe I gave them a new brand of food, maybe new treats or supplements, or they're taking a medication right now and it might be like a side effect from that. How long has it been going on? It's very different to say that it's been a week since he's been like vomiting every day, or if it's been just like 24 hours, or maybe just vomited once this morning. Also, another important question is the frequency of the vomiting or the diarrhea, and if there is blood present. If there is blood present, you want to go to the ER because this is a severe condition and situation. You also want to ask yourself, what is the color of the vomit or the stools? Maybe it's like greenish or yellow, or the stool is like very black, or maybe it has a funny color, I don't know, like pink, and that way you know that he ate something he shouldn't have. To assess hydration, you can ask yourself, is he still eating and drinking like usual, or maybe he's like eating less or not wanting to eat much? Is the energy level normal? And talking about the funny color in the stools, this last question is very important for that, because there's some dogs that tend to eat things that they're not supposed to, or chew the toys, or maybe swallow inappropriate objects like socks, for example. So you want to ask yourself if this is like a normal behavior of your dog, and if there is any risk of this situation, you want to go to the ER right away. So this table over here is going to help you know if you need to go to the doctor right away, if you can wait 24 hours, or if you can even wait 48 hours. I created a vomit chart and a stool or poop chart for pet owners so they can know what color is normal, or they can differentiate the different colors or shapes or texture of the stools or the vomiting. In the vomit chart, we have different colors. It might be yellow, which is the most common color when the vomit is coming from the stomach, and that's due to the bile of the stomach. If it's clear and foamy, it might be because it's full of saliva, and this is a very important point because when the dog is coughing, the vomiting reflex gets triggered. So sometimes they're vomiting because of a respiratory issue or something wrong in the throat, and not necessarily something from the GI tract. Another color can be brown or red, and this happens when they maybe are bleeding from the stomach or GI tract. If the color is more brown, it might be also due to food, or maybe they're eating too fast if you see the whole kibbles in the vomit. But if it's a red color, then for sure it's blood, and this is something that you don't want to wait. So if you see this color in the vomit, you have to go to the vet right away. Another weird color is black, which is crazy, but it's also related to blood. And this black color is due to the blood being already digested. But keep in mind that it might also be that your dog maybe ate some mud or dirt. And then we have our poop chart here for pet owners. The number 2 and 3, the firm and moist texture, are the normal ones, and the rest of them are abnormal. The first one is like very hard. It's like almost like a rock of poop, and this might happen if they have like constipation, if they're going through constipation, for example. The second is a firm stool, very normal, and usually they come like in segments. And the third one is a moist stool. Even though it's a little bit soft, it's still like very uniform and it holds the shape when you pick it up and everything. So that's still normal. But the last two, it's diarrhea. And that's when we have like maybe like a cake shape, like the typical emoji that we see. And it's more like soggy, or it leaves some poop in the floor when you're picking it up. And then the last one, it's a very severe diarrhea. It's liquid and it can change in colors. It might also be explosive diarrhea as well. The next situation is going to be urinary issues, and we have a picture of a cat because they're expert at having urinary issues. And the questions that you want to ask yourself is, maybe are they straining more or vocalizing while they're trying to urinate? Are they not urinating at all, or maybe it has decreased in the last couple of days? Is their energy level like usual, or are they sleeping more than normal? Are they eating and drinking normally? Are they vomiting maybe? Also, how long has it been going on? Maybe it started right after you went on vacation and you left your cat with a pet sitter. Or you might want to check as well if you see any blood in the urine or any smells, or strong colors as well. These are all questions that we need to know before going to the vet. And then again, we have a chart here that lets you know if you can wait 24 hours or 48 hours for this issue, or if you need to go right away to the doctor. You can always share these charts with everyone, and I'm gonna also leave a link down below so you can download it and you can have it. That way, if your pet is having an issue, you can go back to this chart and read this information. The issues that we might have with the eyes are very broad and different. So these questions are going to help you differentiate a little bit between an emergency or something that can wait. So if you see that the eyes are like bulging out or swelling or bleeding, this is something important and it's something that needs to be seen right away. Maybe you're noticing some discharge from the eyes. If so, what color of the discharge? Maybe it's green, maybe it's clear, maybe it's just a little bit of discharge and not all day. Are they rubbing the eyes or bothering it? Are they squinting the eyes? Are they not able to open them? Are they sneezing or coughing more than usual? Maybe they did some different activities lately, like going to the park, going to the boarding facility. How long has it been going on as well? And which eye is worse? Or maybe it's both eyes. And then here you have the chart for the eyes situations. Like I said before, if you see that the eye is bulging out, or it has an injury, or it's bleeding, or there's like severe swelling, you have to go to the doctor right away. But here you can find also other situations that you could maybe wait 24 hours or 48 hours. And now we have ear situations. And these symptoms can be very common because most of the time they're related to allergies. And at least in Texas, we have a lot of allergies. So we see patients with ear hematomas or ear infections almost every day. But the questions that you want to ask yourself are, is he shaking the head? Is she scratching the ears? Maybe they are scratching one ear only, or maybe it's both. When did it start? It doesn't seem painful, or maybe they're like yelping while they try to scratch the ear or when you're touching it. Is there any redness or swelling around the area? Is there any discharge? Is it black discharge or maybe more yellowish discharge? All of these are questions that you want to ask yourself so you can answer them at the vet and also assess by yourself if this is an emergency or not. And then we have the chart over here, and as you can see, we don't have a third chart saying that you can wait 48 hours. And why is that? Because ears are very, very critical, and we need to remember that we're talking about the hearing as well. So if you have a severe infection in the ear and you wait 48 hours because you don't think it's too concerning, that can affect the hearing of your pet, and it can be even long term. So I wouldn't recommend waiting more than 24 hours to get your pet to the vet. And those were the most common situations that we usually see at the vet. And I hope this video helped you to learn a little bit more and to assess if your pet is going through an emergency or not. But like it says over here, ask your vet if you're not sure about what's going on with your pet. This video, it's only for educational purposes and informational purposes, so you shouldn't take this as a diagnose or a professional veterinary advice or a treatment. You need to go to the vet if you are not sure. I hope this video calmed down some of the panic that you might have right now, but I just wanted to let you know that you're not alone. There's a bunch of other pet owners that are going through the same thing. So if you like this video, please share it or subscribe to my channel so you don't miss any of my pet health videos. Thank you so much for watching. I hope I see you in my next video. And remember, this is InnerVet, where we talk everything about pets.